Dr. Love, MD. Everyone give a round of applause for Dr. Frederick Love, MD.
Good evening, everyone.
Dr. Frederick Love is a rock and roll doctor and a former medic in the KISS Army. Dr. Love is going to share some symptoms with you, and these symptoms were reported by the musicians in song lyrics, and you, his residents, must identify the artist and diagnose the patient. The diagnosis just so happens to be the title of the song the doctor's describing. For instance, if Dr. Love says,
The patient is a young male named William Cyrus, who came into the ER complaining of persistent cardio pain and even thinks he's on the verge of a myocardial infarction. The patient also believes that if his vascular organ is somehow informed of a recent breakup, it will explode and kill him.
From this information, it would be Billy Ray Cyrus, Achy Breaky Heart.
Nice.
Y'all are on it. Y'all go to med school?
Number one, good doctor.
Okay, students, our first patient's name is Ronald Belford Scott, an Australian male who, along with 4 acquaintances, claims he is suffering from enlarged testicles. He says that other men may have enlarged testicles, and even some women may have enlarged testicles. However, Mr. Scott asserts that he and his cohorts have the largest testicles out of everyone. Fortunately for Scott and company, this case is not as extreme as the disaster we saw with Mr. Jerry Lee Lewis.
Doc, you wanna give us number 2?
The patient is a young male from Michigan who says he has an elevated temperature. He also has tender, swollen lymph nodes. These characteristics are concurrent with the small skin abrasion incurred after a feline attack. After speaking with the man and assessing his superficial injuries, it's clear that animals hate him as much as he hates them.
Dr. Love, give us number 3.
The next patient is a Welsh female who claims the phenomenon which occurs when light is completely obscured between 2 celestial bodies is somehow taking place inside her own body, her chest cavity more specifically. This occurrence, casting darkness upon a cardio organ inside of a human body, is unprecedented in both astronomy and medicine.
Number 4, Doc?
This is a double diagnosis, students. The patient's name is Mr. Rivers, who says he has an inflammatory lung infection brought about by musical jostling. On top of this, he's also claiming symptoms of influenza caused by upbeat piano blues that was popular in the 1920s. I've seen these melodies coupled before. Huey Piano Smith originally suffered from both conditions in 1957. The Flamin' Groovies had them in 1969, and Aerosmith endured the illness in 1987 for the Less Than Zero soundtrack.
And patient number 5?
The patient is a 19-year-old male named Edward who claims he's suffering from a unique form of seasonal depression spurred by hot weather and sunshine, and not the usual cold weather and gloom. He also claims that there is no cure for his depression. Oddly, he consulted the United Nations and his local congressman before seeking medical treatment.
Wow.
And finally, patient number 6, Doctor.
This one is a psychological diagnosis. The patient is a young Mexican-American male. He claims he's suffering from hysteria, not affecting his mind, rather but a thin layer of tissue that protects cells and organs which have no cognitive function. More troubling is that the patient's cohort, Mr. Senan Reyes, or Sen Dog, claims emphatically that our patient's mind is missing altogether.
Dr. Love.
Dr. Love, everybody, thank you so much for taking some time out of your busy day saving lives to show us these cases.